But I love hypnobirthing. I've been around in the birthing world for almost 30 years. In May it'll be 30 years, and known Becky for at least a couple of decades. I started as a labor and delivery nurse, worked at the hospital, worked for IHC for 23 years, and started my practice in Wyoming. Then we moved to Utah when I married, and was with IHC until 2011. Then I ventured off on my own with my own business. I'm also a doula, and so you're hearing a lot about doulas. If you're not familiar with doulas, that's a good thing to consider. How many of you are birthing here at the facility, here at the birthing center? You're starting off in a really wonderful experience. You get a spot treatment here at the birth center for sure. And certainly the philosophy behind hypnobirthing is that birthing is a normal, natural, physiological process. It is not a medical event. And we explain in class 1 the physiology behind birth and how your muscles are created to work. Your body really does know how to do this. Even before you know you're pregnant, your body's already changed what hormones are floating through your system and already sculpting your body for this growing a baby experience. So we believe that birthing is normal and natural. And so I love that, and part of the reason I left the hospital was because it was such a medical event. And my birthing philosophy ever widened from the hospital ever since. And so I left purposefully to send a different message. In class 1, besides talking about the physiology, we talk about the uterine muscles, and every muscle group in your body is paired. So if your biceps are working, what muscle group is not working? What muscle group is resting or relaxing? Triceps. If your quads are working, what muscle group is relaxing? Okay. And it's the same thing with the uterine muscle. So the uterine muscle is made largely of, it's got 3 layers, but the 2 muscle layers are the longitudinal muscles and the circular muscles. And the longitudinal muscles are like long, strong fingers that reach down and draw those circular muscles up over the cervix, up over the baby's head, like a turtleneck sweater. And so if the longitudinal muscles are working, what muscle group is relaxing? The circular muscles. And the longitudinal muscles are largely congregated in the upper uterine segment, and the lower uterine segment is mostly congregated of the circular muscles. And so we want those circular muscles just being drawn up over the baby's head. We use the imagery of blue satin ribbons, so there's no resistance when you're completely relaxed. But what changes in our birthing world is the fear that is brought in amongst the birthing experience. How many times do you see on TV or in Hollywood or any kind of movie, how many birth stories do you hear that are wonderful, wonderful birth stories instead of fearful induced birth stories? So what happens when fear comes into the picture is that we have a decrease in circulation to the uterine muscle. All the circulation goes to the muscles associated with a fight or flight. What's going to happen there? Those muscles that you're going to run with or fight with are going to get the circulation, and the birthing muscle is not included in that. And so we have a muscle working without adequate circulation, and that obviously affects the oxygenation to that muscle group. So we have a real circumstance where we get into fear, tension, pain, and that causes anguish, and so we want to get away from that. And so we talk about how fear affects labor in the first class of hypnobirthing, and how we can turn that around. So really clearly what you bring to this experience really can affect how it plays out. And the more we can help you feel confident, and you've heard that word a lot today, the more we can help you relax, and you've heard that word a lot today, the more we can fill your tool bag with tools, because all of us would use different tools in that experience. And the more we can help you trust in your body being able to do this, because your body was created for this purpose. You only have a uterine muscle for this purpose. And if that's new news, I want you to really ponder that for a minute, okay? Every month, ladies, when you have your cycle, your body rolls out the red carpet in hopes that conception will take place. And when it doesn't, it sloughs off the red carpet and tries again in hopes that conception will take place. And so your body really knows how to do this. You really don't bring a whole lot to this birthing experience as far as, not the birthing, but as far as the conception, other than the lovemaking part, that's a part. And every time you engage in lovemaking, it's not for the purpose of conception or reproduction. And so you really don't think about that so much during the lovemaking experience. And so your body knows how to do this, and we trust that your body knows how to grow a baby. You don't think about that consciously. However, you do think about nutrition consciously, and you've heard about that today. And then when labor begins, there's really little that you personally consciously do to bring on labor. There's some things that you can facilitate labor with, so natural ways to bring it on or to encourage it. But really, truly, consciously, we don't have much say in that either. baby has a say in that a little bit. But at any rate, let your baby choose your birth date too, by the way, before I leave that session. But your body knows how to do this. And so we just need to get out of the way. And that's why we use the hypnosis and the relaxation techniques, is to get the conscious mind out of the way so your body can do what it knows how to do. So how many of you can really relax at the drop of a hat? You know, in this day and age, I would venture to say that most of us don't. Most of us need to practice relaxation. And so that's why we do the practice. So you've heard about practice in every class that you've heard about, and we do the same thing in hypnobirthing as well. We have practice sessions in class, we have practice sessions at home. I encourage you to read and study and practice each day and listen to your audio CDs. And so that facilitates the conditioning of the mind and body to that flow of endorphins that comes when you are relaxed. And so Lara talked about the flow of endorphins coupled with the oxytocin, which is the love hormone. And that's the same hormonal cocktail that is involved in lovemaking. Think about that one for a minute. So if we can involve that same cocktail of hormones for labor, it should be comfortable. Now, having not had a baby before, how many of you, this is your first baby? Most everybody. Second, third, okay. When you're having your first baby, sometimes you don't know exactly what to expect, but if you trust that your body knows how to do this, and you get out of the way mentally, and we put you in your basically your mammalian brain, your relaxation brain, engaging that cocktail of hormones of endorphins and oxytocin, then your body can really relax and open and do what it needs to do to facilitate birthing this baby. So when there's pain involved, usually something has to be changed. And so we take a look at your position, take a look at baby's position, and certainly mother's position can affect baby's position. And so something has to be changed, and that's where we start. If mother is fearful, we're going to get in that fight or flight. We're going to be having stressor hormones being produced in your body instead of that endorphin oxytocin complex, and that's going to cause some discomfort, some pain for sure. And so we want to keep you out of that fear mode. So largely, guys, your role is actually really big in hypnobirthing. Your role is not only the birth companion, your role is the advocate of her birthing plan, her birthing preferences. You're the liaison with the birthing professionals that are supporting you in your birth. You are the, I'm having a mental cramp here. But anyway, your role is really big, and it's very, it's not uncommon that the men will say, I feel like I worked as hard as she did. And some people want to slap him when he says that, but actually, mother, your job is to relax and let him take care of the rest. Guys, you're the brains behind the decision making. Ideally, we want all the questions addressed to dad. And one of the issues I have in the hospital setting is the barrage of questions you get on admission. So whatever you can do to not let that happen when you actually come in labor would be wise. You need to change policies, but when you're working in the hospital setting, you're getting a group of nurses or staff that hasn't worked with you through the 9 months of pregnancy, like you get here at the birth center, or like you would have with a home birth midwife setting. And so you've got to re-educate them on all the questions they have regarding your pregnancy history and what brings you here at this moment. And so ideally we want to couple that so where it's being taken in the prenatal period and it's being downloaded on a computer system, so when they bring you in for labor, when you come in for labor, they can pull that up and not ask all those same questions. So we'd like to field, when that happens, we have to field all those questions at daddy, so mother can just focus on it. If mom's engaged in answering questions, she's in her thinking brain and not in her relaxing brain, and that causes a disruption of her ability to relax too. And so whatever you can do, you are the consumers. So if you're birthing in the hospital setting, whatever you can do to change that, do so. Okay? So ask ahead of time, what can I do ahead of time to make sure that my paperwork and all the questions you need about me are answered up front before I come into labor. So that's really what I do. So in class 2, we talk about prenatal bonding and your relationship with the baby, and certainly your relationship with your baby begins right now, during conception and during pregnancy, not after this baby is born. And so take time to connect with your baby. They're very aware of what's going on around them. And they're aware of when you're uptight, they're aware of when things are going great, they're aware of when it's loud noises, they're aware, very aware. They're aware when you're planning, they're aware when you're relaxing, they're aware when you're planning this great birth that you want. We also get into the relaxation techniques of hypnobirthing, including the breathing techniques. There's 3 breathing techniques. We get into the visualization, the affirmations, the deep relaxation techniques, and we do all that in class 2 and 3 most of the time. We get that done in 2 classes, and then we also talk in class 3 about your birth preferences. Talk through what might happen, as you've talked about your 12-week courses. We talk through that, what might happen and what you might have to discuss with your care provider when plans change. In hypnobirthing, we really assume the ideal. We plan for the ideal, we really do. Because and what's not in our curriculum is not there for a reason. So we don't readily talk about all that could possibly go wrong. We don't readily talk about the what ifs. We leave that out. And I feel those are questions as they come up. But we do teach you to ask really good questions so that you can be an informed consumer when a decision needs to be made. And we prepare you for when something goes less than ideal. Okay? So we prepare you for that, but we don't talk about it. The more you talk about what could possibly go wrong, the more likely you are to experience that. And working with childbirth since 1994, I used to teach used to teach birth plans all the time. And when things went wrong, I went back to those birth plans, and I could see why it went wrong. And largely, I will take some of that blame, because there were some no's and nots and onlys and nevers in those birth plans that should never have been there. And so be aware of your birth plans. Your language in your birth plan is really critical. So we talk a lot about neuro-linguistic programming, and not in the class, but we talk about it with language. And talk about when you plan for the ideal, you're much more likely to get it. But leave off the no's, the nots, the nevers, the onlys. Because when you put that in, your brain waffles. And so we don't want you throwing off on that negative side instead of the positive side. So be careful of your language. So I would prefer this, I request this, something like intermittent monitoring that you would get here automatically in the hospital setting. You're more likely to get continuous monitoring unless you ask for it. And so if you say, I'd prefer intermittent monitoring of the baby, we don't say unless there's a medical experience. We leave all that negative talk out, okay? And so you're much more likely to get what you want when you use positive language. And starting with gratitude, an attitude of gratitude with your birthing team is really key to getting what you want to. Assume they're going to help you achieve your ideal birth. That is actually their job. As you go into whatever birthing circumstance or center or birthing facility, their job is to help you create your ideal birthing. So your birth preferences is a communication tool to describe for them what it is that you want, and then our job as your birthing staff is to help create that. Okay, not to undermine you or to tell you that wasn't a good choice or to ask you why you decided this or that or the other. Our job is to create that ideal birth for you, and so you're employing them to do that. And so, daddies, you get to make sure that birth plan is honored and respected, and then ask good questions if something should happen that we need to make a change from the ideal birth plan. Okay. In class 4, we start into more of the what can you expect as you're laboring, and how do I know I'm in labor versus practice labor. We do change the terminology in hypnobirthing to a more positive lingo. We leave off the medical terms. Effacement, how many of you know what that word means? So we change it to thinning. Dilation, how many of you know what that word means? We change that to opening. So we change the language so that anybody and everybody knows what that means. And I encourage my couples in their prenatal appointments to use that language. And if they're having contractions, to change it to surges or waves, so that we're using positive language, because we get a whole different physiological response chemically in our bodies when we go into the fear mode. And so we want to avoid that altogether. So class 5, we do kind of an overall review, but we make sure you're prepared for what's going to happen, how this baby moves through the pelvis, what you can do to facilitate that. And with hypnobirthing, we really do encourage you to follow the lead of your body. Your body will tell you what to do. Your body will tell you what you need, whether it be a position change or what birthing position you need to birth in. And honestly, the traditional lithotomy position or upright kind of semi-reclined position on your back is really not the ideal birthing position. And so if that's uncomfortable for you, get out of it. If something's uncomfortable, change your position and find a position that's much more comfortable. So we help daddies have some tools in their bag to know how to facilitate making this comfortable. Because that's your desire. You want her to have this comfortable birth, and you want her to be protected, and you want mom and baby to be safe. And we put you in that's the protector role. That's the midwife role. So, and we put you back in that natural role that you were in. So hopefully that explains what I do. I love what I do. I really love the hypnobirthing method, and I've taught most every method except for Bradley. Who's Bradley? You're Bradley. I've substituted a couple classes, but I've really not taught the Bradley method in my years of childbirth education. So anyway, good luck to you. May this be a joyful experience.